Croeso pawb, welcome everyone to today's webinar, Unlocking the Insights Behind SHRN Data. What do children really think about sleep, social media and physical activity? During this webinar, we'll present information across the following areas. So first, we'll briefly introduce each health behaviour, so highlighting what's currently known and any recommendations. We will share insights from the learner survey data that was gathered, and we'll also give an overview of the qualitative aspect of the study. We will be presenting high-level findings from the study data and also sharing the resulting key recommendations. And finally, we'll be sharing with you some of the next steps to follow on. This project was funded by the Active Young People's Department in Bridgend Local Authority, and their team really wanted to understand how best could they support learners' health and well-being across the local authority. So with our help, we looked through the local authority report, which the team had received as part of the Schools Health Research Network data collection round with learners in 2023. And looking at the data, the Active Young People's Department identified physical activity, social media, and sleep as the three key areas where they wanted to find out a bit more of the why behind the data and how best they could support learners in these three areas. The benefits of being physically active as a child or a young person are well known. So physical activity is linked to improved fitness, mental health. It can improve cardiometabolic and bone health. We can see improved cognitive outcomes, and also being physically active is a way to reduce adiposity. The current guidelines suggest that children should on average do a minimum of 60 minutes each day of the week of mostly aerobic, moderate to vigorous activity. So what this means is that children should be sweating and out of breath whilst being physically active to get the real benefits. So when we looked at the Bridgend Local Authority report of the learner survey data, the Year 5 and 6 responses showed that 47% of them reported exercising 4 times a week or more. So this is suggesting that at least half of the sample are nowhere near the recommended guidelines of 60 minutes each day of the week. When we look at the evidence base around social media use in children and young people, we're also considering screen time. And we know that recreational screen time is one way for displacing healthy habits. So for example, screen time is one of the reasons why we see this high prevalence of both insufficient physical activity and disturbed sleep. So the current literature has shown links between social media use and poor mental health among young people. And it's also shown how social media use is shaping social norms and also impacting peer connections. There's current calls amongst the UNICEF guidance that there should be education on the healthy use of the internet and social media in order to build healthy social support. When we looked at the Bridgend Local Authority report, we saw that 70% of the Year 5 and Year 6 learners own a phone. Just under half of them are using social media a few times a week or daily. And we saw that those highest reports of social media use were amongst the most deprived groups. And then finally, sleep. So we know that sleep has an important role in maintaining health and well-being of children and young people. And there's substantial and consistent evidence relating the duration of sleep to adiposity and emotional outcomes. Just like social media use and screen time, sleep co-occurs with other lifestyle behaviours. So if we think about physical activity, sedentary behaviour, screen time, they're all co-occurring together. And even when we think about sleep, there's the duration of sleep, the timing, the quality, the variability. So it can be quite a mixed picture when you look at the current evidence base. But guidelines do suggest that for 6 to 13-year-olds, they should be aiming for about 9 to 11 hours sleep each evening. When we looked at the Bridgend local authority report, what we found was that 26% of the year 5 and 6 learners reported a bedtime from 10 p.m, which suggests they're not quite meeting the 9 to 11 hours. And nearly 2/3 are reporting sleeping difficulties. Having identified these 3 key areas for focus, our next steps were to speak to the learners and to understand the why behind the data. So we recruited year 5 and year 6 learners across schools who had taken part in the SHRN data round in 2023. And in total, we had 6 primary schools participating, and as you can see, across the east, north and west regions of the local authority. And within each of these schools, we conducted a focus group. So that was a discussion group at each school. And in total, we had 39 learners taking part. And as part of our study design and our methodology, we use semi-structured questions. So they're open and we have prompts so that the learners can feel more comfortable and share information with us rather than being led to what they think that we want to hear. So here's some example questions. So how could school, parents and carers, friends or others make physical activity more fun for you? Thinking about how well you sleep during the week versus on the weekend, can you tell me about the differences, if any? And can you tell me a bit about the types of social media sites that you use? So now I'm going to hand over to Amie, who's going to talk us through the key findings.
Thank you, Kelly. So starting with the results for physical activity, there were 4 main themes that were identified from the focus groups: perceptions and experiences, barriers, facilitators, and suggestions for improvement. And there were 13 sub-themes generated within these. Let's break down the perceptions and the experiences of physical activity. The focus groups emphasised a huge variety of activities that the children took part in, and in a range of locations, from the school grounds, local parks, and at home. Many children highlighted competitive sport as a main interest, whilst others recognised more informal activities, such as playing with friends and taking their dogs for a walk. Whilst all of the focus groups identified physical education as a key opportunity to be physically active. Despite these discussions indicating that children took part in a variety of activities in various locations, there were also barriers identified to being physically active, including time as a barrier. They have limited availability due to homework and other commitments. Another barrier that was mentioned was weather, where formal activities are often cancelled due to poor weather. The body's physical response to physical activity was a barrier for many, with lots of children highlighting that they don't like exercise because they get sweaty and they don't like getting sweaty. And also risk to injury. And lastly, accessibility, where children expressed not having sufficient facilities close to home where they could easily be physically active. On the other hand, children did speak about the facilitators to them being physically active, one of which was the social aspect, where they spoke about being able to play with friends and family and also make new friends through different physical activities. One child referred back to the COVID-19 restrictions, saying, "In lockdown, exercise was boring because I didn't have anyone to play with." Another facilitator was the emotional response to being physically active and knowing that this was good for their mental health, as well as making them feel happy. Moving on to the discussions that we had with children about their sleep. The sleep discussions revealed 4 key themes: experiences and habits, challenges and disruptions, suggestions for improvement, and the impacts of poor sleep. And there were multiple sub-themes here. The children we spoke to had different experiences and habits when it came to sleeping. There were differing sleeping hours and variations in bedtime routines between children, but most reported these also differing between weekdays and weekends. Children had more structured bedtime routines during school nights and more flexibility on the weekends. Sleeping patterns also varied based on school schedules and personal habits, and many children acknowledged that they know that they should go to bed earlier. The children had a very good understanding of the impacts of poor sleep, reporting that they learnt about it through a variety of methods, from school topics to assemblies, parent advice, and some cited through personal experiences of poor sleep. Children recognise both physical and psychological impacts of poor sleep, such as feelings of tiredness, a lack of energy, sore eyes, difficulty concentrating, and mood swings. There were lengthy discussions with the children about their challenges and disruptions to sleep. Common disruptions included technology through the use of excessive screen time before bed, the surrounding environment, including too much noise and room conditions such as it being too hot or too cold when they are trying to sleep. The children having fears such as being scared of the dark or having nightmares. And the emotional well-being of the children, where they expressed concerns around sleep when they were experiencing stress or anxiety, which could keep them awake at night. Finally, we spoke to the children about their experiences of social media, which generated 3 main themes: context, impacts of social media, and suggestions for more positive or safer use, with lots of interesting thoughts within these themes. Children reported using a variety of social media platforms, including Snapchat, WhatsApp, YouTube, Instagram, Discord, and Twitch. Children had different usage patterns, with some children using social media a bit in the morning and then a lot after school. And others reported differences between the weekend use and the weekday use, with one child saying, "Probably use it more on the weekend because then I don't have to worry about staying up early or later." Children reported accessing social media via a range of devices, from phones to tablets and computers. Children were extremely knowledgeable on the impacts of social media, citing positive experiences, such as engaging in activities like watching videos, chatting with friends, playing games, and accessing educational content and videos, clearly highlighting these as the benefits of social media. On the other hand, there were lengthy discussions about the negative experiences or concerns when using social media, including exposure to online bullying and negative interactions. Many children expressed seeing inappropriate content and unsuitable material, which made them feel scared or unsafe, whilst others spoke about their concern for data security and the hacking of information. This quote really emphasises that children considered both the positive and negative impacts of social media, where one child said, "It helps people learning about the world. You can connect with friends and it's really good for emergencies." And then in the next breath stated, "There are untrustworthy people on there. Some stuff is inappropriate and some people can even hack into your device." We know how important it is to ensure that every child's voice is heard, so we wanted to hear how they think that they can improve their physical activity, their sleep and their use of social media, and they produced some really creative and great ideas. The recommendations that the children provided for physical activity were largely about how others can help them be more physically active and to enjoy physical activity more. Specific recommendations included schools providing more variety in PE lessons and in after-school clubs, so that the children can try new sports and different activities. Another recommendation for schools was to utilise all of the equipment and the facilities that they have available. The children spoke about equipment that was often kept in the PE cupboard, but they very rarely got to be used. The final recommendation for physical activity was for the children's families, where they spoke about their families utilising the local area more, being physically active together in the spaces that they did have available to them. Moving on to the social media and sleep recommendations, there was some overlap here. But one suggestion for better social media use included that the children knew which apps they shouldn't use or weren't appropriate for them, but they continued to use them. So they said that they shouldn't use these apps and should have more self-discipline to not use them. Similarly with sleep, the children said that they knew that they should go to bed earlier and have a better routine, but often don't, so they should make more of an effort to do so. However, there were two suggestions that were consistent across both social media and sleep, and these were that parents should impose more restrictions on screen time and social media use, and also with sleep, with their bedtime and surrounding environments, for example, making sure that the room is comfortable. The children did recommend that schools should put on workshops to educate their parents about how to impose more restrictions and to help their parents to understand both the dangers of social media and the impacts of poor sleep. I'm going to hand back to Kelly now to discuss the next steps for the project.
So the next steps for our study are to look ahead to our outputs and dissemination. So we're currently producing one-page summaries for the Active Young Pupils Department and for schools so that we can really outline with further detail these kind of key findings and recommendations across the three health behaviours. We're working hard to develop an academic publication, and this will of course go into lots more information about the wider literature, what we're adding to that current base, and also sharing a bit more insights into each of those themes and sub-themes which Amie talked us through. And importantly, as a next step, we would love to hear more about any of your school efforts to support learners in any of these three areas. So please do get in touch with our SHRN team if you'd like to share insights or ideas, and particularly ways in which we might achieve some of these recommendations which the learners are asking for. And of course, as always, there's more wider pieces to follow. We're currently analysing, for example, some social media data and wider. And if you'd like to find out more, there's some useful references here in which you can access wider reading and resources across each of the health behaviours. So please do take some time and let us know, of course, if you have any follow-on questions. And finally, and most importantly, on behalf of our SHRN team and also our team within the Welsh Institute of Physical Activity, Health and Sport, we'd like to say a big thank you to our partners, the Active Young Pupils Department in Bridgend, and rightly all of the schools, the teachers and the learners that took some time out to share insights and contribute to this wonderful study. So thank you so much. And thank you all for your time listening today.